what you do will be done to you.
All right. Now, Kenya has reactivated coronavirus surveillance systems at the country's main ports of entry to help detect highly contagious strains that have been reported in several African countries. Now, the Ministry of Health says border counties are on high alert as the threat of a mutated version of coronavirus spreading in the country grew significantly. Patrick Amoth, acting director in the Ministry of Health, says Kenya is closely monitoring the spread of the new coronavirus strains across Africa and had invested in robust genetic mapping facilities to help identify and report them at a faster pace. So what are counties doing to man their borders? Daniel Kariuki is speaking to Nyeri Governor Mutahi Kahiga. Daniel Kariuki, good morning. It will be interesting to know what the county bosses are doing. Over to you.
Right. Thank you very much, Brenda. And of course, you've said it right that the Ministry of Health has put on notice, or rather has actually told the counties to be on alert on the new variant. Remember, even some countries internationally have issued travel bans concerning the new coronavirus. I want to speak to Nyeri County Governor Mutahi Kahiga, who is going to be just telling us maybe what are they doing concerning this alert that they have been issued by the Ministry of Health. And thank you very much, Governor, for joining us. Maybe so far, what is the county doing concerning coronavirus and taming this spread of the disease?
Thank you very much. What we need to say is that we have still been on the same mode. Remember, since March, when we had the first cases, we've slowly grown and seen our cases rise to around 1,277 currently, and this one has made us get into what you can call a high gear kind of preparation. So far, we have been able to fix Karatina with oxygen. About 170 beds. Right now we are fixing the oxygen generating plant that is being done there. We have our Mount Kenya Hospital, which we are now also doing the same to that, to the same kind of thing we are doing in Karatina is what we are doing up here. That is, we have about 45 beds, which we have done piping of oxygen. We are now, I think the oxygen plant is being fixed. So that is what we have done so far. We have increased our capacity. Remember, in March we had less than, as a county, we had less than 20 ventilators. So far we have 39. Spread all over our hospitals, so it helps, and it says we are better off than we were. But currently, what we are going to do and what we will reactivate. Remember, we had started our surveillance at the entry points, where we would take temperature and also observe the travelers. We want to be back there on high alert. We want to also get back to the homes and ensure that there is prompt identification and action taken, so that we, should there be, because currently Nyeri has observed a slowdown on the infections, despite the fact that we are not able now to test. We were doing 40 tests a week. We are still not able to do that. We have been we began preparing our lab right in March, and they were ready. We have been waiting for Kemri to release some equipment that was supposed to be brought here. We've been waiting. We've tried interventions, and so I would want to really urge the Ministry of Health to go out of their way to ensure that counties can test, because even the last time we had Kericho was doing, they had to change their mode of testing because either we could not get reagents or something like that. So there is a major problem in this country, and especially as where testing is concerned, and I don't see us winning the battle if we do not test and test aggressively so that we can isolate and treat those that are found to be positive. So that is exactly what we are doing.
Right, and you've said that you've had more ventilators, you've had to increase some of the equipment that are supposed to be used. And we understand, or rather there have been claims that the county has not been having ICU services for the last 2 months. Maybe what's the
2 months, about a month ago. And this is simply because we have no funds. Remember, the National Treasury is meant and supposed to release funds to us monthly. The last disbursement we got was November. We are yet to get December. We are yet to get January disbursement. That's about 1 billion Kenya shillings. Our suppliers have refused to. Initially, we had a challenge. It's also good that you understand. The equipment we use in our ICU in PGH is what we call the MES, M-E-S. That is the medical equipment scheme that was begun way back before I even became governor. Equipment that was placed that is specific. And what we have here is can only use Philips equipment, Philips components and what have you. But unfortunately, they have not had them for the last 3 weeks. We have managed finally to get other suppliers pre-qualified who will now, I think, despite the fact that they are really selling their stuff a little bit expensively, we should be closing that deal today. So in the next 1 or 2 days, we should be back with our ICU.
So residents of Nyeri should be prepared to get, or rather should now, it's a sign of relief to them.
Oh yes, yes.
Now they have the services.
But really, we must say this. Let's say it as it is. As long as National Treasury, COVID, SARS, or whatever they say as an excuse, continue to withhold money that should be in the counties, we will continue to have our people suffering. And I really don't, I must express a lot of pain, especially when people die because we don't have an ICU operating in Nyeri. That is in our public hospitals, because it's so expensive. I have had cases, like we had a case here where we had an accident at Gatito. Right. And we had to take some of the patients all the way to Kereaine. Our hospitals here, that is private hospitals, could not accept them until we paid 75,000. You see, this is really very, very unfair, and I also call upon the medics to be ethically correct, because when somebody is sick, you cannot start talking about money, and I don't even know where this country is going, because in an accident, I mean, it's just ridiculous to think that somebody had planned to have an accident, so they have money. Right. And so you say you will not accept them, you will not admit them in your ICU because they don't have money. And that is a big challenge. Right. So we would want to urge National Treasury. We counties are in dire straits. We owe contractors money for the very first time. Nyeri has not been able to pay those people that did the work in the last financial year. We owe about 400 million, which they are holding. If they could bring the money, we could operationalize all, in fact, even hospitals. I remember the last time we had to intervene, to talk to KEMSA, right, to extend our debt, right, or credit facilities, by allowing us about drugs worth about 94 million, which are now almost, I mean, over in the hospitals. So we need more money.
Right. Thank you very much, Governor, for giving us insight concerning matters to do with health here in Nyeri County. And of course, we'll keep following to know how the situation will be and how it will be changing. Well, that's Governor Mutahi Kahiga or rather Governor for Nyeri, Mutahi Kahiga, telling us just concerning matters held here in Nyeri County. I hand you back to Brenda in studio.
Daniel Kariuki, thank you so much for getting the sentiments of Nyeri Governor Mutahi Kahiga on how counties are manning their borders during this time of the new coronavirus strain. Bringing me to the end of KTN News Center. Thank you so much for watching, and thanks to the men and the women behind the scene who make News Center a success. Enjoy the rest of your viewing. My name is Brenda Zeda Radido.